Vaccine providers are seeing a steady stream of people ready to get their shots. Data collected by the CDC shows the U.S. is currently administering more than 2.4 million shots a day. The states highlighted here in blue have 20 to 24% of the population at least partially vaccinated. That includes both North and South Carolinas. Starting tomorrow, a whole new group of people will be able to make vaccine appointments. Part of Group 4 will be eligible, including anyone 16 to 64 years old with one or more high-risk medical conditions and those who live in a congregate facility, including jails and shelters. State officials say that's roughly 2.9 million people. WCNC Charlotte's Chloe Leshner reports the move into Group 4 comes as people in the first three groups are still competing for appointments.
For many people in this part of Group 4, this has been a long time coming because originally they were much higher up on the prioritization list. The line to get a COVID vaccine is already long, but it was made even longer for people with underlying health conditions.
To be one of the last ones with a chronic disease, isn't great.
Taylor West has type 1 diabetes. It puts him at a higher risk of getting really sick with COVID.
There's already a natural mental burden, I think, on folks with diabetes, just due to the nature of a lot of decisions that we have to make during the day on managing our blood sugars. And then you add COVID on top of that, and I think it's caused even more stress.
And even though people in Group 4 will be able to roll up their sleeves tomorrow, West hasn't been able to get an appointment earlier than mid-April. It's a problem most people will be facing until the supply grows.
Our ability to vaccinate any of the groups really depends on what we have in hand.
More places are offering vaccines now, like CVS, Walgreens, and Harris Teeter Pharmacies. The health departments and hospital systems are scheduling people as soon as they can without pushing earlier groups even further back. Atrium is now placing people in a virtual line, limiting the number who can make an appointment at once. Patience is key. It took 15 minutes to get from 128th to 84th in line.
Everyone is dependent on the amount of vaccine they get from the state, and the state is dependent on what they get from the government. But all signs are that supply will only continue to improve.
No-show rates are continuing to go up because people are shopping around for appointments. Health officials are urging you be sure to cancel any appointments you won't be using. At Bojangles Coliseum, Chloe Leshner, WCNC Charlotte.